Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here with my favorite, although sometimes infuriating, co-host, Dr. J. Calvert. Still love him. Welcome.
It sounds like there's a time limit on that, but I get it, and well deserved. I'm all about that.
I have not slapped you yet, so I don't think it's going to happen on this podcast.
It may.
It may.
Prepare.
Stay tuned.
I've got some stuff for you on this one.
Okay. Well, let's talk about what this one is. This is going to be a podcast about mini tummy tucks because we get this question a lot. Oh, am I a candidate for a mini tummy tuck? Short answer, 98% of the time is no. But let's go into why that would be the case.
How about no?
But to reference what a mini podcast, what a mini tummy tuck is, let's describe what a full or like a traditional tummy tuck is. Doctor?
I mean, I think this topic's really important because mini is such a interesting word for plastic surgery because it comes up all the time.
Mini facelift.
Can I get a mini facelift? I just want a mini. And the short answer, you've already said it, 98% of the time, no such thing.
Right.
There was a very smart, incredible plastic surgeon from Mexico City named Fernando Ortiz Monasterio. And he is just a legend in plastic surgery. And he said, mini operation, mini result. And yeah. I really remember that from my residency because when he came to visit, and he's just amazing. He also taught me in rhinoplasty, first you inject the nose, then you go have breakfast. so you let the logo work.
What you do.
Which is what I do because it makes such a difference. There's nothing worse than operating before the adrenaline starts working. But with mini tummy tucks, the bottom line is that you need to address the fact.
What's a regular tummy tuck? What does that entail?
It's to address lax skin and lax abdominal muscles of the abdomen. It's where typically it's in like men have abdominoplasties too. So I don't want to exclude men completely, but that's more of a weight loss thing, and it's different. And men are shaped very differently than women, and that's not I don't want to get into gender bender issues here at all because it just depends on how you're shaped. There are women that are shaped that are more masculine. There are women that are more, whatever. The bottom line is you're dealing with lax skin and lax muscles.
Lax
typically,
meaning just
they're loose. Yeah, typically. After pregnancy, typically.
Pregnancy, babies, weight loss.
Typically, yeah, all of those things. But it's the skin that's more the issue. The muscle work, you can do that a lot of different ways. And I can do muscle work without taking skin out. I have something called the Newport Beach abdominoplasty, which is for these ladies that weigh, 95 pounds. They gained 22 pounds with their pregnancies. And they don't have lax skin, but their muscles are demolished. Their skin snapped back and the muscles are bad. So you go in with an endoscope, you fix the muscles, and the skin is not the issue.
Because the muscles that we're talking about here are the rectus abdominis muscles.
Rectus damn near killed us. No, I had to say it. Sorry.
I know. It was coming.
I'm trying for the slap, actually. At this point, I'm going to see if I can instigate and get it to just get
the fury
rage
going.
roiling through your abdomen so that you can reach over and give me a
roiling through my rectus abdominis, which are the six-pack muscles that go down the center of your abdomen, and with significant weight gain and then weight loss and or a pregnancy, particularly in small women with big babies, the muscles just can't always accommodate the amount of volume that's being stretched and placed on them. So they separate. It's not a true hernia, but the muscles have sort of come apart in the midline. And when that happens, they don't work as a functional muscle unit. So it's really hard for them to give your core the stability that it needs. I often hear complaints of back pain. And it allows the abdomen to protrude. So you can have a super skinny person and a really skinny patient, but their abdomen just sticks out. And sometimes they even look like they're still pregnant because those muscles are not in alignment and they're not doing their job, which is to keep everything flat. So fixing that rectus diastasis is a huge part of shaping the abdomen during a traditional tummy tuck because it's what allows us to get that flat contour.
Or even scaphoid, where it's kind of sucked in. Yeah, and that's doable. You just have to understand that the this is something that comes up once in a while where, and it's typically in weight loss patients, the quality of the tissue that you're sewing together does make a big difference.
Huge.
So like if you've had a lot of weight loss, the tissue that you're putting together can be very thinned out, and so there's various levels of success in abdominoplasty that you have to
that you can get.
You have to know.
And yeah, the muscles themselves, and it's not so much the weight loss that contributes, it's the fact that at some point these patients were significantly overweight, and there was a lot of pressure thinning and flattening and actually really damaging the structure of these muscles. So even if you bring them into alignment and they're sitting right next to them, the quality of the muscle fibers and their ability to contract is actually been damaged. Those muscle fibers have been stretched almost beyond their ability to snap back and actually contract. So that's where you get the varying degrees of scaphoid or flatness. So you have the muscles, and then you also have the skin, which is sort of another 50% of the abdominoplasties. And this is, again, weight loss patients that have had babies. They have loose extra skin. And that is what is addressed in both a mini and, well, we'll get to the mini. That's what's addressed in tummy tuck. You remove a big section of skin from the lower abdomen. And that incision typically goes hip to hip. It can go beyond the hips towards the back, depending on how much extra skin you have. But usually it's a big smile incision, lower abdomen from hip to hip. And then there's usually an incision that goes around the belly button. And what that does, the incision around the belly button, is it releases the extra skin that's around the belly button and above it. The belly button is a very tethering point to the abdomen. You can, if the belly button's in place, you can pull on that lower abdominal skin all you want. It's not going to move the loose skin above the belly button because it's being tethered by the belly button. You have to put an incision around the belly button to release it and allow that extra skin to be pulled down and removed. So that's why we typically do have to do something to the belly button in a traditional tummy tuck to allow us to get all of that extra skin and not have the extra skin around and above the belly button still floppy and loose.
Correct. And it's all about that, the skin is the issue. And this is why I'm going to bring some stuff up here that you ain't going to like, because I do a lot of different...
Let's talk about the mini, because we haven't even defined what the mini is.
Well, the mini, I don't even really know what a mini is. I think a mini is what you're talking about, is taking some skin out of the lower abdomen and, not releasing the belly button and all that sort of thing.
Yeah,
is that what you consider a mini?
That's a classic mini. A mini is not doing anything to the belly button, just putting an incision. Some people think that it's going to be smaller than the hip-to-hip incision. And taking out the lower skin of the abdomen. You can affix the muscles, the rectus abdominis muscles below the belly button if you can get to them and suture them down. But people think that because it's a mini, the incision is going to be shorter and not necessarily go all the way to the hips. The problem is if you limit that incision to kind of like a C-scar, like a C-section scar, and you don't extend it to the hips, you have all this extra skin on the sides of your incision, and then you're coming back to the operating room to revise it, and you end up making the incision all the way to the hips anyways. That's the thing. If you have extra skin from a baby, do you think that it just is in the center of your abdomen? No, it goes your entire lower abdomen. And so you need that longer incision to get all the extra skin out. So in a classic mini, you just do that incision, however long it is, at the lower part of the abdomen. You can fix the muscles of the lower abdomen up to the level of the belly button, and you kind of call it a day. You don't put an incision around the belly button, and that's it, plus minus some lipo if you want to do that.
That's a mini abdominoplasty.
That's a mini abdominoplasty.
So when I was in Pittsburgh, Ken Shestak, who was one of my professors, published an article called The Marriage Abdominoplasty, which was a play on words and a marriage of techniques. So it was that he would liposuction the upper abdomen aggressively, but he would also use a long laparoscope and a long needle driver, which we have one at Roxbury, to repair the muscles from the xiphoid all the way down. And
so the upper abdomen as well.
Exactly.
So the muscles you typically wouldn't be able to get to with just a classic mini abdominoplasty.
So this was a really nice advance because, first of all, it's not easy to do.
That is not easy.
It's not fun to do. But there are patients, it's the right operation. I'll give you an example. High umbilicus, high belly button, that's way up high. Now, we're going to talk about another treatment for that. So high belly button, laxity below the belly button because the baby's pushed everything out down low. Upper's not bad, but there's a little bit of skin laxity that you can address with liposuction and then some other energy type of modality like a Renuvion.
Right.
No financial interest, obviously. In fact, they have a financial interest in me because I have to buy another one for our other OR, so they like me. But that technique works, and you just need to be, comfortable with the repair of the muscles above the belly button with the endoscope. You can also do something called a floating umbilicus, where it is sort of a mini, but it's sort of a maxi because you're still making the big incision. You're not taking the belly button out. You're leaving it attached to the abdominal wall skin. You're pulling down. You're fixing the muscles under the flap and then bringing the skin down, reinserting the umbilicus. The lowest I'll go is to the level of the hips.
Yeah.
And I've done that a fair amount too, and it works. It's not quite as satisfying as but I wonder if that patient would be happier having a little bit of a T-scar where the umbilicus is. And that's the other thing people do is they'll do a sort of a mini plus where they will release the belly button, bring it through the flap, and then just leave a scar in between. Like they'll just sew the scar closed. And I've seen a lot of that.
I just call it a tummy tuck. That doesn't take out the full. I mean, that's a tummy tuck.
Yeah.
Because you've translocated the umbilicus, and whether or not you can get the old opening out,
because dealing with that opening is
kind of
a thing.
It's a thing. But to me, that's a full tummy tuck because you've done the work you need to get all of the skin out. And my issue.
I just thought it was poor planning. That's how I always saw that.
I plan for that. I tell them
you're going to have a scar in between, and that's cool with them. They're okay with it.
Yeah, and so my concern with the marriage one that you were talking about is that even if you can get the muscles repaired with babies and just time with age. If you've had a baby and you are over the age of 40 or 45, you're going to have loose skin of your upper abdomen.
You are.
You just are. And that's not going to address that extra skin. And I do get these patients, and it's always tricky because usually they're thin, they're skinny, they have extra skin, but it's not really that bad. And so the options for them are limited. And what I typically go to is I say, you're going to have this scar. So what we're talking about is if you, in a typical tummy tuck, you have that incision on the lower abdomen and you remove all the skin from that lower incision to above the belly button. And that old belly button location is removed with the skin that's being removed. And then you make a new incision and the belly button comes through it. Belly button's attached by a stalk to the muscles of the abdomen. So that's a classic. However, some people don't have enough extra skin to remove everything from that incision to above the belly button, but they have that loose skin above the belly button, and you need to release the belly button so that you can get it and pull it down. The problem is now you have that hole where the belly button used to be. It's in a lower position, but it's not low enough to be removed with the amount of skin that's being removed. And so you have to close it up, and it gets closed as a vertical incision, and it usually sits just above the lower abdominal incision. So you have the lower one that goes across hip to hip, and then you have like a, 2 centimeter, 3 centimeter vertical incision that sits right above it. So no, it's not ideal. You have an extra scar on the abdomen, but you've been able to get the abdomen tight. I mean, you are tight. You've gotten every extra piece of skin out, and the only person who's going to see that is if you're naked. It usually is hidden under bikinis very well. And again, scars fade, scars heal. So everybody has different ways of attacking this. Some people are super averse to having any kind of scars, and they'd rather do the energy devices and things like that. So there's many different ways depending on what you want and what your ultimate goal is. But I think that a true mini tummy tuck, which has a limited length incision and only addresses the skin and the muscles below the belly button, is not ideal for the vast majority of patients.
Agree. Mini operation, mini result.
Mini results.
And, that's the thing. You want to design, and I design all of my abdominoplasties custom for for the patient, and they are, because they're all different. They really are.
They're all different.
You know, and I saw a patient just yesterday who was like, she's like, oh, can I get a mini? Said the words and like, and really it is the lower abdomen. And I was like, well, I guess we could do a marriage thing. We could do a mini. And I was like, but look at your, look at the upper
abdomen.
Do you want this like this? Because it's going to stay like this. I'm not doing much to it. I'll do some suction. I'll do some Renuvion. But it's going to kind of be like this.
Yeah.
And she was like, no, I need that tight. That's why I'm doing this.
Right.
That's why I'm spending. What does it cost? What does an abdominoplasty cost? Today,
that's a range.
Today in
September
in
2024.
Beverly Hills. Yeah, today.
It is a range, because if you
$100 million.
If you come to me and you have a BMI of 35 and I need to spend 3-4 hours doing liposuction before I even make a skin incision, that's going to be a lot more than the patient that comes to me and has a BMI of 20 and really just needs their skin removed and some muscle repaired. So how much work you do is going to affect your price range. And so it can range anywhere from $15,000 to $30,000.
Mine's a little more than that, probably double that. Depends on the work that I'm doing.
Yeah.
But probably in the $45,000 to $60,000 range. And I rarely do just an abdominoplasty. It's usually like a mommy makeover or something like that. So then it's even upwards of that, but they're work, and they are expensive. I think the average price around the United States is obviously lower than both of our prices in Beverly Hills, and so just look up in your area. Those Google is pretty good at giving price ranges in certain zip codes, but there are the outliers.
Yeah.
Beverly Hills ain't cheap. We've made that point a few times. And is there a difference in recovery with a mini versus a regular traditional abdominoplasty?
Yeah, I think so.
I do too.
I think so, because in a traditional, you really are getting all of the skin released up to the xiphoid, up to the sternum. You're really getting all those muscles tight, plus minus some liposuction. So the recovery is a little bit more intense. I would say the length of recovery is probably the same. You still need, several weeks to normal life, 6 weeks to full exercise. That's the same between the two. But the level of uncomfortable pain, discomfort that you have is definitely going to be more with the full. But it's super manageable. We were talking on the order of a couple days worth more of pain and discomfort. By a week, most of these patients are feeling okay enough to function and get around and do life.
Yeah, we have a post-op instructions for abdominoplasty patients podcast. So reach back and check that one out. Maybe we'll update that one again soon, because it's probably a little different. We're doing painless, drainless, and those sort of things now, where we're not really drainless. Even on my painless, drainlesses, I still put one drain. I'm down to one drain.
I'm a one drain.
I'm not the zero drain guy yet. I hate fishing for seromas. It's just not fun.
Yeah, I don't like complications.
Yeah, me either. Anything else with this?
No, I think
you got it.
I think that's pretty much it. That was
Has everybody got the difference between mini and
a traditional?
Yeah.
Hopefully, if not,
some combination of things you can do in certain situations, but mostly
just know that if you're thinking about getting a mini tummy tuck, you probably just need a tummy tuck.
Can I get a mini? I just like a mini. No.
Sorry, no. Wouldn't we all? No. I would say the only person that I would say, okay, yeah, I guess we could do a mini, is that patient that comes in and wants their C-section scar revised, and they don't really care about the muscles. They don't care about getting the upper abdomen addressed. They just would have had this indented scar. I mean, that's okay, that's a mini tummy tuck. But even those patients come back and they're like, but I still have this extra skin on the sides. I'm like, because we didn't do a tummy tuck.
Just understand there's a reason to do the real thing.
Yes. So listen to your plastic surgeon and, do what they suggest, or go to a couple plastic surgeons and get a couple of
some opinions.
Options and ask, what can I expect after this? What's the realistic result?
Totally.
And whatever works for you, whatever you're comfortable with, whether it's a scar burden or whether it's a little bit of extra skin or you don't want any extra skin, see what your options are and make the decision that's right for you.
I think that's it. There you have it.
Great. Well, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90212, or where are we today? 90069?
That's a good question.
We're in a different studio today in West Hollywood, so not sure what the zip code is, but
I think we're the 90210 though still. It's just us.
It's just us.
Yeah, that's how it goes.
And there it is, folks.